My name is Christina Lisa, and I would like to speak to you today about a certain kind of birth trauma and how I work with it in a therapeutic process with children. A birth trauma that is fairly common is what I call emergency C-section. This is where it's unplanned cesarean, and it can be a great distress for both mother and child. I want to talk about a case of a little 2.5-year-old boy that I worked with who had had an emergency C-section and was exhibiting some behaviors that were really concerning his parents. He was not walking, and he was 2.5. He would crawl a little bit, but it was a kind of a funky kind of crawl. He cried a lot, he didn't talk, and he was having a lot of trouble just speaking. Couldn't pronounce his words, a lot of baby talk. They came to me because of those issues, and also several things that had happened to him in the birth process. When he was starting down the canal, it was not going well. He was not turning, he was not in the right position, and he was actually at a point where they were afraid they were going to lose him and he was going to die. So they did the emergency C-section, which we are very grateful for, because of course then he lived. Then after that, he had a circumcision, of course, which boys have, but I consider that a surgery. Then within a month, one of his testicles had not descended, so they used surgery again. Every time he had to go to the doctor or to the hospital, he would scream bloody murder. He was so upset. He would get angry, he would punch his parents, and they were very, very distressed about all this. When he came to his first session with me, I decided to just play ball with him, just roll a ball to him. And as I rolled the ball back to him, sometimes it wouldn't go right to him. And I'd say, well, go ahead, just go get the ball then. And he would scream, or he'd say, Mama, you go get the ball. He did not want to move. I then instructed the parents to help me with what I call my sand tray therapy. This is where I have a sand tray and I reenact traumatic events that have happened to children. Because he was so young, I had him sit on his parents' lap on one side of the tray and I sat on the other. I instructed the parents to tell him, I love you, you're safe now, and to repeat that over and over, because that's the issue that he didn't have in his birth. He did not feel safe. So what we're trying to do is almost create a new womb that says you are safe, because these parents loved him dearly and they wanted him to know he was safe. While they said those things, I started reenacting the birth in the sand. So I used my toys, my little hospital toys, and I started to say, okay, here we are, there's a little boy that's going to be born. And here's his mom, and here's the doctors, and he's going to start to go down the canal. He's going to start to be born. And as I'm starting to talk, he's getting very agitated. He wants to get down. He doesn't want to sit on his parents' lap. He really wants to get away. And I tell the parents, no, it's important that he stay there. This technique is called holding time. And then as I continued with the birth, because I said, okay, now he's going down the canal, but something's wrong, something isn't feeling good. And he's not doing so well. And they're going to start to cut. And as I took a little plastic knife that I use to just recreate the doctors cutting the mom's tummy, I'll tell him they're going to start cutting the mom's tummy. He started screaming. He wanted to get off the chair. He wanted to move around, and he was in great distress because he was actually experiencing the emotional impact of this birth again. But I asked the parents to stay steady, and they did. And though it took a while, we went through that birth for our first session. He was exhausted at the end. Parents took him home. We had about 4 sessions, and at the end of the 4th session, the parents came in to me reporting that he had to go to his other surgery with the other testicle descended, and he was fine, no crying, no upset. He did it very well. He was now trying to walk. His grandparents were really happy because they could see him trying, and they were working with him to get him to walk. His parents put him in physical therapy because his muscles really needed some help. They had him in speech therapy, and he was beginning to really respond to that. When he came to me at the end, he was smiling, happy. He held out his hands and gave me a big hug. We played ball again, and he went to get the ball himself. He was a happy boy. So this is a case of how the emotional impact of a traumatic birth affected a boy physically, emotionally, and once we cleared it, he could move on with his life. Thank you very much for joining me today. I hope that you will subscribe to my channel, and I'm enclosing my information about my website and my email. Thank you very much.